mababa ho dito niya. Dahil doon sa opera niya. Kagaya nga po yan, ako ay walang trabaho. Kaya humihingi lang ako ng tulong sa mga kaibigan ko na malalapit din sa politiko. Yung mga mabubuting loob.
Pagka ang reseta sa akin ay 30, minsan 5 lang, basta hindi ko mabili talaga lahat dahil mahal.
Normalmente no hay los medicamentos que uno requiere, ¿no?
No hay. La mitad tengo que comprar en la calle y la mitad acá.
Meron din po dito, kaya lang, minsan kasi yung mga pasyente malalayo na rin po sila. Kaya naghahanap din sila ng malapit sa ng bahay nila.
You need to give the people the capacity to demand for the things that they need.
MeTA is an exciting new way to bring people together to discuss and negotiate around all of the critical issues which limit access to essential medicines for poor people.
MeTA tries to do two things: improve the quality of information and sharing of that information in countries about the price of medicines, the quality of medicines, the availability and the promotion of medicines. The second thing it tries to do is generate accountability for what that information shows, to bring together the constituencies that are involved. It's the private sector, it's the government, and it's civil society.
All 7 members of MeTA, we can change information, we can change data, we can learn from each other.
It has expanded our friends, our network of friends, from multi-stakeholders locally to stakeholders even from other countries.
Just working together to achieve the final goal, which is to improve access to medicines for the poor.
The most important thing that MeTA is focusing on is the disclosure of data. This will help all of the stakeholders to determine where the gaps are. And it will make things more accountable because now we have data and we can measure how we will move forward.
With MeTA, all stakeholders are coming together to talk about drugs in a way that you have give and take, and there is frank discussions, and we all identify the challenges and how to address them.
We have to deal with stakeholder groups which usually don't talk to each other. So MeTA brings them around the table and they address the critical issues, and this is how we move policy forward.
It is a unique opportunity to reinforce the work of the WHO with countries and to have a more inclusive approach around the planning and implementation of medicines policies in countries.
Working in a multi-stakeholder way allows you to come up with solutions that are realistic, most of all. I think that's the principal advantage, because what you understand are how the interests of the different bodies are going to play out.
As MeTA continues its work and continues to allow people to engage in this forum, they might, I think they will, influence change in policies, and this will in turn affect the consumers, as the patient at the end will benefit from more positive policies that are targeted at helping them.
If we can rationalize the system of procurement by promoting transparency and accountability, then we should be able to bring down the cost of medicines, also improve quality.
MeTA stands for transparency along the chain, letting people know what happens to the products from the ports through the warehouse to the consumer.
People are really happy that we are talking about something that they never thought it would be discussed.
It's a huge challenge dealing with non-literate populations. When patients go to a hospital in the local languages, they are not only talked to, but they can identify with the poster that you've put there.
The other thing that we have done in MeTA is that every Thursday there's a radio program. Whenever a person now goes to the hospital, those who've heard the dialogues that we have had on radio. At least now they ask.
MeTA actually also helps us in the country and even across the different countries of the world to be more responsible with the way we deal with people, the way we deal with medicines. No matter how small a stakeholder, they have a voice.
It's a good initiative, and I hope it will be reflected in other countries also.
What we'd really like to do is expand the Alliance to strengthen this approach of improving accountability, of improving transparency as a key way to improve health outcomes in the medicines field.